Good evening. Good evening, Dr. Sai Praveen, Mudit, the entire team from Dozee, Mr. Kumar Sharma, if he's still here, all the nurses, and all our friends from the healthcare fraternity. This entire room is from the healthcare fraternity. I don't belong to it directly, but it's an absolute, honor, more than anything else, to actually be standing here for probably just under 5 minutes to speak to this audience. Extremely grateful for the opportunity, and very, very humbled by the nurses who are here, honestly. I have grown up I'm an only child. I've grown up looking after my parents who are no more today, looking after my grandparents who are no more today. And every time that they've been at hospitals in Chennai and Bangalore and Kerala, and I've been there throughout, I think if there's one fraternity that I just absolutely salute from the real bottom of my heart, it's this fraternity. Thank you ever so much. My name is Meera Harish, like I was introduced. I work with an organization called Sattva Consulting. You saw the report that was just unveiled. At Sattva, we are today India's largest social impact consulting firm. We work with large corporates, large foundations, non-profit, social enterprises. But more importantly, it's not who we work with or what we do. It is what is the mission that we are driven by. And very often missions are very lofty, right? Sometimes, very often, very unachievable. But it is only when you have an unachievable dream or a mission that, you wake up every morning energized and passionate going after it. At Sattva, our mission is to eliminate poverty in our lifetime. Yeah, that is very lofty, right? But I think what one is feeling very excited about being here today once again is that this room is filled with people who every day are moving that needle inch by inch, trying to eliminate poverty. And you'll wonder what is the connection, right? But I do want to quote a piece of, a data that many in this industry know, which is that close to 50 to 60 million people in India are annually driven to poverty because they can't afford their healthcare, out-of-pocket healthcare expenses. Right, 50 to 60 million. I mean, just think of that staggering number, right? So as all of us and the Dozee team and all the work that is happening here happens and it improves lives of people coming in as patients, each one of us is moving that needle inch by inch. And that is what very often is just gratifying in this journey that all of us are, in all the work that all of us do. We are at Sattva, and I have a colleague of mine here who's going to follow me in a couple of minutes with the insights from the report, which was just unveiled. We were just very honored again to do the retrospective assessment for Dozee because I think what they've done is absolutely stunning, and I don't need to talk about it much more. We've heard of it a lot. We just hope that once you hear the insights, and Dozee and the team have already kind of really internalize the insights from there, to look at the impact that it creates, right? It's not just the business metrics, but it's really the impact that a solution like that really creates in this country. And we just hope that going forward, they continue to kind of move that level of impact higher and higher. This is just really the very beginning of that journey. I want to, like I said, I do not come from a healthcare background at all. And therefore really almost have no right standing here, except that I work at Sattva. So I want to take just a couple of minutes to tell you a story, if I may. I have always believed, and I think, Dr. Sangeeta Reddy said that, and Dr. Sai said that as well, in some way or the other, which is, and Mudit as well, which is really pushing the boundary of innovation. Right? We talk of solutions. The solution, the Dozee solution, is also in some way them having pushed the boundary of innovation. So while we talk of technology and AI and everything that it can enable, I think what we need to also remember constantly is that ability for entrepreneurs and teams here to innovate and also push the boundary. And I don't know whether Dr. Sangeeta, when she said, beyond the realm of possibility, when you talk of beyond the realm of possibility very often, Doctor, it's really how much can you push the envelope? How much can you push the boundaries of innovation? So I want to just share a story for 2 minutes of pushing the boundary of innovation in the healthcare space from something that I have been a passionate student of, which is cross-pollination innovation, right? Which means that you're innovating not just from the space that you work in or the sector that you work in, but look outside and look beyond and see if there is an impact from there onto your work, and is there a way that can solution for you better. I don't know how relevant it is going to be to everyone here, but I'm just such a big fan that I'm going to share this story. This is the story of a hospital in London called the Great Ormond Street Hospital, which is a pediatric surgery hospital, right? And it's one of the finest in the world. They do all kinds of surgeries for children, and I think they've been around for close to probably 75 to 100 years. In the mid-90s, there was a very, very high incidence of mortality in the hospital. Several of the surgeries, the surgery would go very well, but the children then kind of subsequently die. So there were a lot of studies conducted in the hospital on why this was happening. Obviously, the surgery and the instruments and everything related to it was checked. And nobody could figure out why this was happening. Why is it that mortality is going up? We are the best. We are using the best. It's the best people, the best surgeons, all of it. Where is really the problem? So after a lot of study, they actually discovered that the problem was the movement of the child, the patient in this case, from the operating theatre to the ICU post the surgery. The problem seemed to have been there, right? So the hospital kept wondering, what is the solution here? That seems to be the problem, but one doesn't know how to fix it. There were these two tired, and this is not a story, this is real life, I'm calling it a story, this is a true incident at the Great Ormond Hospital. There were two tired doctors sitting at evening coffee after a long day of many surgeries, Dr. Goldman and Dr. Martin Elliott, sitting in the hospital cafe having coffee, watching television. What was on TV was the Formula One race was going on, and they were just watching that, right? And it's just such a coincidence, Mudit, that I'm saying this story here when you come from the racing background yourself. So they were watching TV, and as the race is going on, you know how the cars come into the pit stop, and quickly the tires are changed and everything is changed, etc., and the car is just back out to the race. That whole process in the pit stop actually is done in under 7 seconds. In under 7 seconds, the car is out again, right? Completely overhauled and ready to race. These two doctors were looking at that and said, my goodness, if they can overhaul and do whatever is required to the car in under 7 seconds, is there a learning for us in the process of taking the child from the operating theatre to the ICU? Because when that happens, as we know, and sorry, I'm talking to a room full of nurses and doctors, and you see this every day, there are a lot of people around the child on the stretcher as the child is moved, right? There's the anesthetist, there is the doctor, there's the surgeon, there's whoever else, etc. In that process, they realized that roles were not clear, that system was not clear, the process was not clear. It was just very chaotic, right? And because of the chaos is when whatever it is that went wrong, and hence the mortality rates that were high. The next thing that the doctors did was actually call the Ferrari team right, in Italy, and have them come over to the hospital at Great Ormond. This is late 90s or early 2000, and actually study the process at the hospital of how the child was moved. And it later led to the Ferrari F1 team writing a 12-page process protocol for how a child post-surgery needs to be moved to the ICU. This 12-page process, after implementation at the hospital, led to, whatever, all the issues, and I have data to say that whatever it is, the patient errors, etc., went down from, I don't have the mortality rate, but the patient errors went down from 30% to 10%. Right? Who would imagine that a hospital would be able to learn from a Formula One team? Right? So that really is the power of innovation. Just wanted to end by saying that we are honored to have done this assessment for Dozee, and we will see the insights in a couple of minutes. I'll request my colleague Ojas to come on in and present the insights. And we hope that in some way the impact of the work that you see from the assessments will lead to your looking at, the Dozee team looking at both the impact as you keep looking at business metrics as well, right? Always keep impact in mind as you look at your business metrics as well. And just the last piece to take on from my story is that I hope, just for some of you here at least, that story of the fact that anything, anywhere can cross-pollinate and inspire you to innovate in any other space. So I hope the healthcare system, which is, and the healthcare ecosystem, which is the most important for our country and the world, leads to and looks at a lot more cross-pollination, solving problems both in this country and the world. Thank you very, very much for the opportunity. Over to you, Ojas.
Hi, good morning, good evening, everyone. I understand we're slightly over time, so I really just want to talk to you about this impact study and really share an executive summary of what our findings from the study were. Again, very glad to have partnered with Dozee for this. Really honored that we've actually tried to measure the impact of the work and the ecosystem over here. Sorry. Yes. Very quickly, a quick background. We wanted to measure the impact by studying the adoption of the Dozee technology in hospitals and public healthcare institutions. We wanted to study the impact on the quality of patient care, the reduction of workload in nurses and hospital staff alike, and also the reduction in terms of the operational inefficiencies in the hospital, especially in public healthcare. I think Meera's already given. I think the sampling that we took for this was really look at 6 hospitals, 14 doctors, 60 nurses, and 5 administration heads really that we wanted to look at. The first key point which really stood out for us, and this is something especially keep in mind, this is in the public healthcare study, was it was very easy to install as well as adopt the Dozee solution, as you can clearly see by the numbers that are there, right? What we are seeing is, and we saw an unreal amount that we couldn't predict, nor could the Dozee team predict, that the nurse took to the solution like water, right? And as you can really see, nurses themselves see the effect of digitization of patient vitals, as 97% nurses really put out this data. The second and the most important thing which actually was the impact was, as we've already seen from the videos that were played, was every day 2.5 hours were actually saved from a nurse's day at the hospital. What took a nurse and what took 50 minutes in a day to monitor patients' vitals now just took 10 minutes. Dozee till date has created at least 1,874 life-saving alerts so far as of, I think, December 2021, and which really gives us an estimate that approximately about 144 lives can be saved every year for every 100 Dozee beds that we create. As we already know, 1.3 days have actually reduced in terms of the patient lifetime at the hospital, at the ICU, and really what we are seeing is an estimated 2,500 patients can be monitored in an average ICU, public healthcare ICU, every year. where people are getting access to critical healthcare over here. Secondly, 3 million additional patients are also able to really get access if you can potentially scale this solution across all public healthcare hospitals in India. Lastly, I think was really the fact that 26% cost was actually a clear reduction in cost in public healthcare, primarily because of the reduction in the ICU stay, which actually led to the majority of 2.3 crores of direct savings in a public healthcare hospital for every 100 beds, as well as 0.4 crores as an indirect savings due to nursing hours really saved, and which ultimately leaves us to this scaled solution that ultimately, if you can potentially look at scaling this across Indian public healthcare, you're able to save 2,150 plus crores every year for the Indian public healthcare infrastructure. We've already covered it, right? But I think just want to end with almost like an opportunity, right? India has around 700,000 plus ward beds, plus 80,000 ICU beds in the country across 8,000 secondary and tertiary care public healthcare institutions, not including primary healthcare, right? So just want to end with there and really come in over here. Thank you, and I'm again just apologize. I know we're sort of running over time, but please do come in. Yeah. Thank you so much.